So we are live on Instagram and YouTube. So let us continue Nash Therapeutics study streak. Uh, all right. So we have one attendee and many others are still joining. Let's continue start the study streak. So today we'll discuss a very important remedy which Dr. Nash describes in truckloads or you can say innumerable pages, and the remedy is causticum. Now, if we go to the source books and the literatures, we know that this is the remedy which is proved by Dr. Hahnemann. And other thing is that it is one of the great antisoric remedies. So, what are the peculiar features that Dr. Nash writes, and how does he describe this remedy and the cases that he saw in his practice from different perspectives? This is all about Nash therapeutic study streak. What is the essence of the remedy described by Dr. Nash? Not verbatim, but something that is important. So good to see Dr. Bhandare, Dr. Lekha, and a few new people. We are doing this Nash therapeutic study streak as a representation of what Dr. Nash has written in his Leaders in Homeopathic Therapeutics book. In the way that he has written, the order that we have maintained is the same. We have taken some excerpts or ideas on how and where he saw these remedies. And today we are discussing the remedy which is causticum. Great weakness is one of the characteristic features of all the potassium salts. Whether it is the Kali group or the causticum, we should know that any patient who complains of weakness all the time should be, you know, thought of causticum or the Kali group or the potash salt at once. Next is that there is a faint like weakness. The patient is not actually fainted or he is not gone in that fainting stage, but he is on the verge of fainting, faint like weakness and sinking of strength with trembling. So you will see many patients who will tell you that there is a kind of a weakness. You will get them investigated, everything becomes normal or everything comes normal, rather. That should be the statement. The blood reports are normal, the physician has told there is no problem, but there is a constant weakness and the s- strength is lacking. There is lot of trembling. So you should think of potash salts. This is what Dr. Nash gives us an idea. And once we realize that this is the way we should employ the medicine, it becomes easier in clinical practice, because what we read from the academic point of view is just the keynotes of the remedy or something that we use for the memory purpose at that moment to reproduce it in the exams. But what we should know is that we should also go ahead and know what are the clinical aspects of how the patient will present to us. And weakness is one of the very key important symptoms for potash salts. Sluggishness or kind of a laziness you will find in all the carbon group. Excess waste of strength, or you will see that lot of evacuation of energy or sudden loss of energy or gradual loss of energy you will find in acids. So once you know these general idea about the remedies, it can be about the potash, about the carbon, about the acids, about the sulfur element, your job to prescribe remedies in the clinical practice becomes easier, because what we learn from academic point of view becomes very much bookish in nature, and what we learn in the clinical in from the clinics, from the doctors, from the webinars, from the cases becomes little different. So Dr. Nash tells us about causticum, that there is faint like weakness, sinking of strength with trembling. and there is similar condition which we know also present in gelsemium. But along with that, in gelsemium we also have the drooping of the lids, and the another remedy, third remedy which Dr. Nash gives as a trio over here is sepia. So local paralysis, especially of the eyes, and there is drooping of the lids, gelsemium, sepia, causticum need to be thought of. You can make this as an observation also in certain patients. They are not able to open up the eyes fully, or due to some clinical conditions, or due to their own weakness, that they are not able to conjure up to gather the strength to increase their eyelids strength. It's just half open, or you can see that it's not fully open. So the weakness is mentioned in the first paragraph by Dr. Nash. And now what becomes interesting next is very interesting. And this weakness goes on to show that there is gradually approaching paralysis. So the part is not paralyzed as such. In most of the cases, there is a functional, disturbance, or the functions point of view. The part is locally lacking strength to produce the energy for efficient functions. Like, for example, Dr. Nash gives vocal cords, muscles of deglutition, tongue, eyelid, face, bladder, extremities. Now, I think the first page should be enough for a practitioner to get a real good idea about causticum as a remedy in the clinical practice. If you need something more like a nitty gritty things, you go further. Otherwise, this is the essence of causticum, and all the causticum patients will have these traits, one or the other traits that you see. But going further, we see that causticum as a remedy can be employed in nervous twitchings, in chorea, in convulsions, in epileptic attacks, in progressive locomotor ataxia. And that's what he links the weakness. Dr. Nash links the weakness of the potash salt, or the causticum specifically, from the weakness to gradually approaching paralysis. So it's not like an acid who has depleted in strength and does not have anything. It does have the strength, but it is bare minimum, like an you have mobile and it's functioning at 5% or 7% or 10% battery. That is what causticum would be. Acids would probably be 1, 2, or even 0% battery left. Once you understand this from the clinical point of view, how the patient presents, that he's able to speak but in a hoarse voice, husky voice, he's able to perform a function, nervous neurological changes are there, conditions are there, but it is not efficient. It is like, just a makeup of, doing things because he wants to do it. So it's like a progressive paralysis which is going on, going on, going on, going on, and may paralyze the patient in future. You will have some cases which will be paralyzed completely. You can think of caustica, but most of the cases, functional level disturbances, you will see that it is a weakness which gradually approaches the paralysis. Next, Dr. Nash goes further to share about the mind, melancholy mood, sadness, hopelessness, and another thing which is interesting, apt to look at the dark side of everything. Now, this is taken in the new repertories, you will see as the rubric pessimist. So, once a person has a trait which is, making him think in a particular way, the author of the repertory, which is, currently present in this era, have picked it up and coined a new term which you see in the repertories. Whether it was there in the provings, whether it has been told by an n number of provers, this is very important. If it is just there by one or two provers, it's very not to be taken. If it is there by a lot of patients, then you can take into consideration. So paralysis after stroke, if it is a local part, if it is single part, Dr. Ruturaj, very nice question. You can think of causticum, but look at the pathology. You can see if the pathology is in the brain, the blood is occluded, there is coagulation, then you may even think of some snake remedy also if you want to go a bit deeper. But if you don't have any symptoms, look at the signs and the symptoms and prescribe causticum based upon that. It can be one single part, that is very important. So going further, Dr. Nash tells us about how causticum is affected and looks at the dark side of everything, especially due to care, worry, grief, sorrow, like the remedies Ignatia, natramur, phosphoric acid. And this melancholy mood, it's a melancholy mood which we should know. It's a melancholy mood which alternates with anxious, irritable, or hysterical mood. So this he completes the mind for Dr. For causticum from Dr. Nash. And next the remedy, next about the remedy Dr. Nash tells us is there is gauze before the eyes, as if there is a wheel or like a curtain, an opaque curtain. And this is mostly in the cases of incipient cataract. Our authors, especially our stalwart homeopaths, Dr. Burnett, have cured and written a book on cataract. Dr. Clark, Dr. Cooper, all these authors have written so many literature about cataract. Nowadays, it's difficult to catch hold of a cataract patient because the ophthalmologists have put a wheel in front of them and kind of pull them before even the patient completes the treatment from you. It's difficult, but you need to convince the patient. If you give the medicine for 6 8 months based upon one peculiar symptom, for example, in cataract in young women, especially 30s or 40s or 45 early age, I have always given sepia. It's a single remedy in all the repertories and also in source books. If it is just a progressive cataract or the blur before the eyes, no, the symptom is present, causticum also serves best. Quinine is another remedy which has helped. So in this way, you'll have to make the patient, convince for a good number of months of treatment and give them the result. Then you will get a lot of cataract cases. Otherwise, they are always going to land up with the ophthalmologist and get themselves operated. So for the eyes, Dr. Nash gives us a very good example of how incipient cataract causticum can be given. Next, he goes further to tell about ears, deafness with noises, echo of his own noise, own sound. I cured two, three cases of hearing deficiency based upon this symptom of re-echoing of own voice. Ears are burning, and they are red. This is almost like sulfur again. So next he goes to face, which is yellowness, not like jaundice, but kind of a yellow tinge which is there. And especially there is paralysis of a particular part, especially Bell's palsy. Now, this was not a term which was coined that time after Dr. Nash or during that era it was coined. But for Bell's palsy, you can see that causticum is one of the very specific remedies. I myself had the Bell's palsy and I started with belladonna 10 immediately as soon as I got exposed to the cold air. Within 6 to 8 hours, the numbness and the tingling and the facial distortion improved, and then I kept myself on causticum 10 This is how you improve. Otherwise, a facial paralysis is expected for a long term. So once you know how to start, when to start the medicine, it becomes important to clinically know when to stop and when to continue the next medicine. For the face, causticum is a good remedy, especially in paralysis, local paralysis, rheumatic or psoric exposure, psoric cause, and prosopalgia, stiffness of the jaw. The patient cannot open the mouth. You will see that in most of the cases of fibrosis, especially the gutka eaters, the betel leaf eaters, or in cases of those who have the habit of keeping themselves busy in the by some or the other intoxications locally, that will give the result for you. Causticum is the only remedy. For the tongue, Dr. Nash tells us that there is paralysis or indistinct speech without complete paralysis. So you can see what was mentioned on the first page or the first few paragraphs of the causticum. Weakness with gradually approaching paralysis is reflected everywhere in the remedy. So you can just understand this essence and give this remedy to all such cases where There is not a complete picture that you see right now, but something that is approaching towards it. It can be a picture of paralysis also, but mostly it will be this tug of war between the body and the disease. For the throat, Dr. Nash tells us that there is burning in the throat, which is not aggravated by swallowing, and there is a kind of a rawness which he describes throughout the remedy, and tickling in the throat with dry cough. There is minimum expectoration, but after long coughing. Now, again, this goes in sync with the local paralysis, or something that he cannot bring out because of the local muscles which are weak, especially the throat muscles. And Dr. Nash compares this particular phenomena of burning and less expectoration with sulfur. Next, he goes further to describe the bowels constipated, frequently constipated patient, but unsuccessful, and desire for stool is always there. So there is again this tug of war between the frequent constipation and unsuccessful desire for stools. And stool is better by standing, which is a very vague position. We all learn this during our academic years, but rarely to see a patient with this particular symptom we will find. Next tip Dr. Nash gives for hemorrhoids, causticum, how it is important. There is swelling, itching, smarting, raw, moistness, stinging, burning, which is aggravated by walking and aggravated by thinking of it, or aggravated by even talking. So much is the sensitivity. So potash salts, you will see that they start with sensitivity and go to weakness and gradually approaching paralysis. Causticum is one of the good remedies which you will get to prescribe in all the cases of hemorrhoids. Number one thing is that it's a localized complaint in a small part. If there is itching in the hemorrhoids or in fissure cases, this remedy can work like an intercurrent and clear up the symptoms to some extent to give you the path to the next prescription. Next, you have by Dr. Nash, which is causticum mentioned for urinary organs, especially itching in the orifice of the urethra. And we all know a very peculiar symptom, and this is very important. In all the cases, we can confirm constant and frequent urging to urinate, or there is involuntary urination, like and there is spasmodic urination or movement of the urethra muscle, like Cantharis and Nux vomica. So Dr. Nash then gives us a case of chronic cystitis which had this peculiar symptom of spasmodic retention of urine, and how causticum helped. Next is that there is involuntary passage of urine in coughing, sneezing, blowing at night, blowing in the nose at night when asleep, when walking. So when the patient is doing any other activity, this particular muscle, since it is weak, it spurts some urine drops outside. This is going to be your characteristic to prescribe causticum, or in fact the potash salts per se, as a group. Urination is insensible, so at times the patient may not realize, and then the patient tells that I had this complaint, I never knew it was there, but it used to happen. And the urine routine report, if you have attended my sessions on Ellen's keynotes, you will see in one of the sessions I mentioned how urine routine report you can refer and prescribe remedies. And for causticum, lithic acid and lithates are present in large quantities. Dr. Hughes also tells about this, and Dr. Nash quotes Dr. Hughes about how you can see all these elements in the urine routine and prescribe, causticum as a remedy. It is very disheartening to see that homeopaths are relying more on mind symptoms and getting themselves enveloped in all those mind symptoms and interpretation of mind symptoms, without realizing that a simple thing like urine routine can give you lot of good avenues to prescribe the medicine, which you can't interpret, just you can't change. You need to understand the physiological disturbance and the remedy which is present. I am collecting a few cases and some literature on this, and if you are connected with me through this Instagram and YouTube and Facebook, whatever channel, you will get to know about this particular point very soon. So, Dr. Saurav Arora, I thank you for your valuable comment, which is very important because since you are in this field of research, you will be having this very good idea of how some data which is very valuable and you can't change those data. We can rely on it and it becomes a good prescriptive pointer. Let's go further with causticum from Dr. Nash. And there is this hoarseness in the morning, rawness, sudden loss of voice. Again, you see that the vocal cords are unable to exert their function or produce the voice which is needed, and the laryngeal muscles refuse to act. So few days ago we did the remedy gelsemium and we saw how the muscles refuse to obey the will. This was mentioned. Exactly similar picture you will see in causticum. Laryngeal muscles refuse to act. Over there in gelsemium, we saw that the entire body or the person's extremities or some system is unable to obey the will. In causticum, it is a single part or single muscle which will refuse to obey the will of the mind or the body or the action which it needs to do. This is the difference. Clinically, you will see the patient telling that I cannot do this particular function. If the patient tells you that I cannot just move about or there is a lot of weakness, there is simply the inability to move or I just don't have the energy, gelsemium is the remedy. In the first case, causticum is the remedy. Next, you see that chronic hoarseness remains after acute laryngitis. Lot of patients will report to you that there was throat infection and after that I am having this particular cough which remains or the hoarseness which remains. Causticum is going to help them immensely if you know how to prescribe based upon the indications which we just discussed. Next, you have is a deep bass in the voice. Drosera is the other remedy, and causticum is another remedy. In all cases of throat complaints, vocal cords, causticum as a remedy is either going to cure it or open up the case to something else. Maybe cure 70 to 80% of the case and give you the chance to prescribe something better, or leave the body to act on its own and give good result to the patient itself. For causticum, Dr. Nash goes on to the locomotor system and tells us that there is cough with pain in the hip and involuntary urination, better by drinking water. Especially cold water is mentioned in all the books. You will see in Boric, Fatak, everywhere. But what happens is that when the person is having cough, he may avoid cold water because he knows that it will aggravate. They may feel better by just drinking plain water. So I have confirmed this many times from different patients, and they have avoided cold water, but they have taken simple water to feel better with the cough. And this is the point that you can pick up and clinically prescribe causticum in such cases. Cough with inability to raise the mucus must be swallowed. So there is a very good rubric based upon this, that the patient just cannot bring the cough out, and that's where it gets stuck up in the throat and goes back. That you can confirm from the patient, and you will very well prescribe causticum and it will clear up the case. Cough with rawness and post influenza, you can think of causticum, Eupatorium perfoliatum, and rust ox. Causticum wins, as told by Dr. Nash, if the urine is involuntary. So you can see how a concomitant symptom which is present in another part of the body helps to prescribe us this remedy, which is can work beautifully in simple cases of influenza. Next, for the back complaints, Dr. Nash tells us that painful stiffness when rising from the chair. There will be many cases who will come to you with MRI, CT scan reports, or simple X-ray reports, loss of lumbar lordosis, or stiffness in the back, or there is L4, L5 dislocation, etc., etc. They just can't rise as quickly as they used to do earlier. Causticum is a remedy that can help. Thuja is also one of the other remedies. It is present as a single remedy in Kent repertory rubric. Pain straightening up the back from the sitting position. There is a rubric which you can find out in the back chapter. Next, Dr. Nash tells us about causticum is paralysis of upper or lower extremities, drawing and tearing pains, rheumatic affections with contractions. Now you will see that you will have strange pathologies, arthritis deformans, rheumatoid arthritis, etc., where there are contortions of the fingers and legs, the fingers of the hands and the toes. And the patient is coming with a huge HLA-B27 report positive and some ANA or anti-CCP positive. And you will think what to do because I don't have any other symptom. My dear friends, if you see all these things and you are not prescribing causticum, it's a sheer loss of remedies, great power which you have failed to understand. Drawing and tearing pains, rheumatic affections with contortions is the prescription for causticum in such cases. There are tearing pains, there are drawing pains which are characteristic of causticum as a remedy. And if you see more deeply, then you will understand when to prescribe causticum in such cases. Next, Dr. Nash tells us that causticum, sulfur, and apis are the three remedies which are very much having the single symptom which is common, burning. But how is the burning of each remedy different? Once you understand this, you will be clear with the three remedies. Apis will have burning with stinging. Chub raha hai. This is the Hindi terminology that the patient will use. Causticum burning is there with the soreness. दर्द हो रहा है जैसे किसी ने मार दिया है. And sulfur, there will be burning associated with itching. So these are the clinical differentiation which Dr. Nash gives. And if you are reading Nash, well and good. If not, grab a copy wherever you can and read the entire description of how Dr. Nash gives for each remedy. We are almost halfway through the Nash Therapeutics and we will finish in the next 1 month or so. So I would urge all homeopaths to go through this book. And last but not the least, Dr. Nash gives us that causticum is a remedy which is Hahnemann's antisoric. So all the cases that get stuck up and you are giving sulfur left, right, and center, thuja, medorinum, tuberculinum, causticum can be one of the intercurrent remedies. In fact, if you go in Allen, and we did this in Allen's keynotes, if the case comes to a standstill, causticum is one of the remedies. So if you know this from one book, other author gives you the case, you bring those things together and prescribe the remedy. That's how you take forward from one author, learn from other author, and prescribe in your clinical practice. And it is a prominent remedy which is also given like sulfur in suppression of skin diseases. He gives a case of prosopalgia, face pain, where some skin trouble was there in the patient, and that homeopath who had given the medicine had got stuck up. Sulfur was given with no benefit. Dr. Nash came in, saw the case, gave causticum 200, and the entire facial pain what was gone away. So in this way, whenever one remedy works or gets stuck up, what is the next to give? That also is given by Dr. Nash. You don't get lost. You just follow the beacon of light which is given by him. So last but not the least, causticum is also one of the remedies which can help in warts like thuja, or in burns or post burn cases like soreness after the burns that remain, which also is causticum. Last, he tells you about modalities aggravated by clear fine weather. So when the weather is fine, the pains of causticum get worse. When the weather is bad, the causticum patient feels better. If you remember this modality, you are going to help a lot of patients with this remedy. Nux vomica is exactly the little bit different. It is aggravated in dry weather but better in damp weather. So that brings us to the end of causticum as a remedy. Keep following Homeosetu WhatsApp channel, Instagram, Facebook, YouTube, X, everywhere, and you will get some interesting learning in 2025 and further from here on.